Okay, welcome back to infectious diseases in the MLA content map. The next one is Lyme disease. Lyme disease is caused by a tick bite, and usually they'll give you a target lesion on the skin. So make sure you know the history you need to take, right? The patient might have gone to a tropical area, maybe an area where where Lyme disease is endemic or is commonly found, where you'll find ticks. So know the cutaneous lesions, look at pictures, know what history you need to take, know the treatment, okay, know all the different presentations. A Lyme disease may present in a multitude of different ways, so multiple choice questions or OSCE stations, Lyme disease may show up, commonly shows up, do it well. Next you have malaria. In the case of malaria, know how to interpret lab findings, okay, know the investigations you need to do, and know how you're going to manage this case, okay, and manage this patient and advise them on how to stay away from or prevent getting malaria. Okay, so all the preventative measures to control mosquito bites. Okay, so do that as well. Next, you have measles, right? Make sure you do measles and rubella, and make sure you know how to differentiate measles and rubella. Look at a lot of pictures of measles and rubella. Okay, ask the patient about vaccination. If it's an OSCE station, always make sure you ask them about vaccination, okay? And just know the presentation, know the history, know what it looks like. This is something that commonly shows up. It is important. Next, you have meningitis. Again, a very commonly tested and important topic. You would have probably covered this in your neurology sections, but yeah, just know all the different presentations of meningitis as well, photophobia, rash, know how to interpret a CSF analysis, okay? Know all the red flags and the complications of meningitis. So do it really well because meningitis does tend to show up. Could show up in children, could show up in adults. Okay, mumps, we've already talked about mumps or orchitis. That's very important, but mumps on its own as a facial swelling could show up, and there may be a child, so you may get a picture of a child with a facial swelling, or you may get a picture of an adult with a facial swelling, sorry, not a picture, but an actual adult in an OSCE station with their hand on their face hiding a facial swelling. So that's how mumps may show up as well. And then you have necrotizing fasciitis, which is just, you'll probably find gangrene here, or you will find gangrene here, know what to do in that case. I have seen it show up in multiple choice questions, not as much in OSCE stations, but could show up definitely. Know that you need to admit the patient and what you need to do moving forward. Next, you have notifiable diseases. Make sure you memorize the notifiable diseases in for your OSCE stations, for your PLAB, for your UKMLA, whether it's your MCQ exam or your OSCE. Know the notifiable diseases. They love to ask you about the different notifiable diseases, and know that if a disease is notifiable, you need to tell the patient it's notifiable and why it's important, because you're going to breach confidentiality in this particular case, right? You're going to tell the authorities that you found this disease. Next, you have osteomyelitis. Know the x-ray of osteomyelitis, okay? Look at involucrum and sequestrum on x-ray, and usually this shows up in diabetic patients or patients who are immunocompromised, so just know what to do in the case of osteomyelitis, familiarize yourself with what it looks like. Next, you have otitis media. This is something we've covered in ENT, so it may show up as acute suppurative otitis media in children who turn up the volume on their TV, know when to give antibiotics and when not to give antibiotics, know the findings on otoscopy, know how to perform an otoscopy as well. So otitis media does show up. Next, you have perianal abscesses and fistula. This usually shows up in multiple choice questions. Haven't seen it show up as much in your OSCE stations. Okay, so look at pictures of this, but know the findings or the description of these in words. Okay, so what color lesion you'll see, or what kind, how you describe the lesions in words. Okay, just look at that as well in this case. Next, you have periorbital and orbital cellulitis. This is something you'll cover with cellulitis, so just know what drugs you're going to give and what it looks like on in pictures. Okay, next you have peritonitis. In the case of peritonitis, know what you're going to find on ascitic tap, or and just the serum albumin, okay, ratio, and just what you're going to do with peritonitis, and what findings you're going to observe. Okay, so peritonitis does show up. Do it well. Next, you have sepsis. Sepsis is something they love to test in the case of emergency scenarios. So it may be a sim-men or a simulation mannequin, talking mannequin scenario where you need to stabilize a patient with sepsis, give them fluids, right? Do the sepsis 6. Do the sepsis 6 really well. They love to ask you about this in your multiple choice questions as well as your OSCE stations. Next, you have septic arthritis. This is usually a differential diagnosis in the case of your joint pain scenarios. Do it well, know how it presents, know what you need to do in these cases. Okay. Next, you have surgical site infection. Usually, this shows up as a patient who has a surgical site infection after they've had a surgery and they've been sent home, and now they're angry that they have an infection and they think you made a mistake or you did something wrong. So just know how to manage these kinds of patients, how to talk to them, how to explain the condition to them. Next, you have tonsillitis. Know the criteria for tonsillectomy, know when to do a tonsillectomy, know how to examine tonsillitis, look at pictures of the inside of the throat where you see the tonsils, inflamed tonsils. Also do peritonsillar abscess as well. In case of tonsillitis and peritonsillar abscess or quinsy is very, very important. Do it well. Next, you have toxic shock syndrome. This usually shows up in the case where a female has a tampon in for too long or a nasal packing has been done for too long. So in both those cases, make sure you do your toxic shock syndrome really well. Know that it's caused by Staph aureus, could show up as a patient with shock, of course, right? Next, you have Trichomonas vaginalis. Do this really well. Know the difference between this and Gardnerella vaginalis and candidiasis, okay? These are the three that you'll usually find in the case of vaginal discharge and female genital tract infections. Know the color of the discharge, okay, and know what you need to do. Upper respiratory tract infections usually show up as viral infections. The patient may say, give me antibiotics, and the patient doesn't need antibiotics because they have a viral infection of the upper respiratory tract. There may also be bacterial infection of the upper respiratory tract, and you need to know the difference between viral and bacterial infections. In the case of URTIs, also it may show up in a child with a URTI. So just URTI is a very broad topic, but as you go through the different topics, I'm sure you'll cover this as well. Next, you have urinary tract infection. Know how to look at a urine analysis, a urine test. Always do a dipstick, okay? Make sure you know what drugs or which drugs you're going to give pregnant patients, non-pregnant patients, males, for how many days, what drugs you're going to give exactly, okay? Know the presentation of urinary tract infection. Do this well. They love to test you on this as well. Know the causes of this. Know what you're going to advise the patient. Okay. Next, you have varicella zoster. This may show up as chicken pox, or it may show up as chicken pox, or chicken pox, or it may show up as shingles or post-herpetic neuralgia. Okay. So make sure you do it in both those cases. Very, very important. Look at pictures of this and know how to manage these cases. Okay, next you have viral exanthema. I haven't seen it show up as much in OSCE stations. So, I mean, look at pictures, do it well, know what to do in these cases. I have seen it show up in multiple choice questions. Not as much in OSCE, but do it for the OSCE as well. Viral gastroenteritis. Rotavirus is usually what they're testing you on in these cases. Patient may be admitted in the hospital and now they've developed so they may have been admitted for some other disease and now they've developed gastroenteritis or diarrhea, and it's usually rota. Okay, next you have viral hepatitis. Now, in the case of viral hepatitis, do all of them. Do hepatitis A, B, C, D, right? Do all of them. B, do serology really, really well. For C, know how it spreads. Notifiable disease, right? And just know what to do with hepatitis. It does commonly show up multiple choice questions and OSCE stations, so just do them really well. Next, you have whooping cough. So pertussis or whooping cough, know the organism, know how you're going to manage the patient, know the red flags, and what you're going to do in these cases. So infectious disease or infections are very, this topic is very extensive, okay, when it comes to your OSCE or your multiple choice questions. So, and a lot of it you're going to cover in all the other topics you're going to do. Okay, so don't worry about it being too extensive. You're going to keep revising these topics in every single section you prepare. Okay, so just going through the presentations really quickly. Acute rash, of course, you could get that in any of these cases, right? Anosmia, sinusitis, right? or COVID. Next, you have your chest pain, right? Infectious endocarditis, pleuritis. Um, you've got your pericarditis, right? You've got your diarrhea, very, very important. Know how to take a history of diarrhea. This is really important. Know what you're going to ask a patient when it comes to diarrhea. Facial and periorbital swelling. You've got your mumps. You've got your orbital cellulitis, all that good stuff. You got your fever, right? That could show up in any of these infections, right? Hematuria, important urinary tract infections, or maybe you've got a bladder infection, right? Maybe you've got a kidney stone leading to an infection. Next, you have hemoptysis, right? You got your TB. You've got loss of smell, which is basically anosmia. I don't know why they've repeated it, but you got your neck stiffness and pain, meningitis, night sweats, TB. Could show up in other diseases, painful swollen legs, cellulitis, petechial rash, right? Um, Next, you have your pleural effusion. May show up as empyema as well. So make sure you look at chest x-rays and know what pleural effusion looks like, what pleural edema looks like, what empyema looks like, okay? Next, you have your sore throat, right? Could show up in a number of different conditions. In particular, they love to test you they love to test sore throat in the context of tonsillitis. Next, you have stridor, epiglottitis. So know what stridor is, and also travel health advice. So travel history, very, very important. Whenever you're asking or talking about infections, travel history is really important. Urethral discharge, ulcers, warts, your genital tract infections, urinary symptoms, your lower urinary tract symptoms, your frequency, burning, right? Next, you have vaccination, very, very important. Whenever, especially when it's a child or even in adults, you want to ask about vaccination. Vaginal discharge, right? Candidiasis, Gardnerella, trichomonas. Vomiting could show up in infectious gastroenteritis, H. pylori, right? Vulval itching and lesion. Know which particular genital tract infections in the female cause itching, okay? Lumps, okay? Could be a Bartholin cyst, could be an abscess. Next, you have weight loss, so TB or any other kind of infection. So yeah, that covers infections. See you in the next one.